They called it the Big Beautiful Bill. For Oklahoma families, the consequences may be measured in missed doctor visits, postponed operations, unpaid hospital bills, and longer waits in crowded emergency rooms. These 6 Oklahoma officials voted for the law. The question for this video is simple: who got permanent protection and who got sent to the waiting room? The first warning has already arrived. Oklahoma's Active Affordable Care Act marketplace enrollment fell from 265,157 people to 179,600 in 1 year. That is 85,557 fewer insured Oklahomans, a decline of more than 32%. Those people did not stop needing care. Their insurance cards disappeared. Their medical needs did not. Accuracy matters. The Big Beautiful Bill did not directly cause every coverage loss showing up in 2026. The first cliff came after Congress allowed enhanced ACA premium tax credits to expire and tightened eligibility rules. The Oklahoma delegation then voted for a law that prepares a second cliff: Medicaid work reporting, more frequent eligibility checks, and limits on funding arrangements that support hospitals. Celia and Jorge Monreal live in Tyler, Texas, with 5 children. Jorge does hard concrete work. His knees are deteriorating, and he may need knee replacements to keep working. Without affordable coverage, the family faces choices like doctor visits or groceries. This destroys the lazy stereotype. Jorge's problem is not that he refuses to work. His knees are failing because he works. Eileen and Barry Spickler of Ottawa, Kansas, show another common problem. Barry worked nearly 50 years, then lost employer coverage before Medicare eligibility. His ACA plan had helped cover kidney stones, scans, and x-rays. When the monthly cost was scheduled to rise from $109 to $246, they expected him to go uninsured until Medicare. Kidney stones do not wait politely for Medicare. Andrew Hicks of Little Rock is a warning about Medicaid work reporting requirements. When Arkansas tried an earlier work requirement, Hicks was driving for Uber and attending graduate school. He lost Medicaid because he did not successfully navigate the reporting process. About 18,000 people lost coverage under that experiment, while research found no significant increase in employment or private insurance. People lost coverage. Employment did not rise. When people lose insurance, many do not rush to the emergency room right away. At first, they do the opposite. They skip doctor visits. They delay scans. They stretch prescriptions. They postpone surgeries. Eventually, some get sicker and more expensive to treat. The medical need does not disappear. It gets more expensive. HCA Healthcare estimated that ACA patients becoming uninsured produced a $400 million adverse financial impact in a single quarter. Inpatient surgeries declined, outpatient surgeries declined, and emergency room visits rose. That is exactly the wrong direction for a hospital system. Fewer scheduled procedures, more urgent care, and more unpaid bills. That bill lands somewhere. Oklahoma hospitals were already providing more than $740 million a year in uncompensated care before the latest coverage decline. Now healthcare leaders estimate $6.3 billion in Medicaid reimbursement cuts to Oklahoma hospitals over the coming decade. Unpaid care is shifted to hospitals, insurers, employers, taxpayers, and paying patients. This reaches everyone. A weakened hospital does not maintain separate waiting rooms for Republicans, Democrats, Medicare patients, and uninsured patients. Everybody waits together. If uncompensated care rises and Medicaid reimbursement falls, rural hospitals, maternity care, surgeries, and emergency staffing all depend on the same weakened financial foundation. The defense is usually that Washington could not afford the existing healthcare system. But this was not a deficit reduction bill. CBO's latest projections estimate the law will increase cumulative deficits by about $4.7 trillion from 2026 through 2035 and reduce projected federal revenue by about $4.9 trillion. This was not a budget rescue. It was a priority list. CBO's distributional analysis shows the direction of the law. Households in the lowest income tenth lose about $1,200 a year in resources, largely because of Medicaid, SNAP, and related reductions. Households in the highest income tenth gain about $13,600 a year, largely because of lower federal taxes. These are averages, but they show who the law was written to help. The law permanently restored full first-year depreciation for qualifying business property. That can include certain business aircraft, though the provision covers far more than jets and must meet tax rules. JCT estimates permanent full expensing costs about $362.7 billion over 10 years. The contrast is hard to miss. A family may postpone an MRI. A qualifying corporate jet can move to the front of the tax line. Congress also permanently raised the estate and gift tax exemption to $15 million per individual beginning in 2026, indexed for inflation. A married couple may potentially shield about $30 million. Very few Oklahoma families worry whether only the first $30 million of the estate will be protected. Yet Congress made that protection permanent. It did not make enhanced ACA premium help permanent. Congress wrote different calendars for different Americans. The deductions advertised to tipped workers, overtime workers, car buyers, and seniors all expire after 2028. The estate tax protection, qualified business income deduction, and full business expensing were made permanent. Washington did not forget expiration dates. It chose where to put them. Here is the sentence that says it plainly. Working people got a coupon that expires after the election. Wealthy interests got a lifetime membership. That is not a loophole in the calendar. It is the shell game hidden in the calendar. The Oklahomans losing health coverage did not have teams of tax attorneys proposing amendments. Concrete workers with damaged knees were not hosting Washington fundraisers. Early retirees caught between employer coverage and Medicare did not have lobbyists waiting outside committee rooms. But the industry seeking permanent tax provisions did, and Washington's lobbying firms had an extraordinarily profitable season. The 6 officials pictured at the beginning were elected to represent Oklahoma families, not only the people who can hire lobbyists, tax attorneys, and political consultants. Congress did not eliminate the need for health care. It moved the bill to hospitals, employers, patients, and communities. The next emergency room wait may come with 6 signatures attached. That leaves one question for Senator Lankford and Representatives Hearn, Burchine, Lucas, Cole, and Bice. When you chose between protecting health coverage for Oklahoma families and protecting permanent tax advantages sought by wealthy and corporate interests, who exactly were you representing? Follow the money at wclangdon.substack.com.